What's going on? We're okay. I really hope this doesn't mess up on me because what's up, everybody? Hey, how y'all doing? How y'all doing? Welcome, welcome. We are doing NCLEX questions today on this Wednesday. We're doing NCLEX questions. Do them every Monday, Wednesday, and Friday at 5:30. Hey, NCLEX questions, NCLEX questions, NCLEX questions. I need for you guys to like, I need for you guys to share, I need for you guys to follow. That is the trifecta that TikTok wants and that I need in order for me to get out to the people that need it. All right, so don't be selfish. So I need 100 people in here and I need 1,000 likes. If I don't have either one of those, we ain't going nowhere. So it's up to you. But of course, I've been a nurse for 3.5 years, going on 4 years. I worked ICU, I worked OR, I worked PACU, and I was in the Navy for 16 years. So if you guys can't see that stuff right there, I was in the Navy for 16 years, and yeah, I come here to give you guys NCLEX questions. We do them every Monday, Wednesday, Friday at 5:30. Make sure you guys like, share, and follow. Angie says, "Hi, Kevin. I'm here early. Let's do that." Hey, look, let's do it. But you already know if we don't got 100 people up in here, and if we don't got 1,000 likes, we ain't doing nothing. Nothing. NUFFIN. Nothing. So in order for us to do something, y'all gotta do what y'all gotta do. But of course, I want to know who you are, where you're from. Nurse CC, I see you up in there, Miss Lady. Hey, if you guys need to do anything with dosage calculations, a blessed RN, Nurse C, will get you hooked up on dosage calculation. Trust and believe me. All right. But of course, like I said, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, so my phone broke. My original phone, it broke. So right now I'm using like this iPhone. And I'm not a fan. I don't know how y'all like iPhones. I don't know. I'm an Android guy. I've been an Android guy since day one. I'm not an iPhone guy at all. So, hi, I'm an OR nurse from Trinidad, interested in doing NCLEX. I love it. Mars, I'm glad that you're here. I'm glad that you're, hey, we got 100 Hey, we got 100 folks in here. You know what I'm saying? So, where the likes at? Where the likes at? Hey, get iPhone the go. Absolutely not. Absolutely not. Go ahead and see yourself out, ma'am. Megan says, checking in from Tennessee, graduated May 3rd. 3 weeks of lecture. I know that's right. Android all the way, baby. Android all the way. Me either. iPhones for the feds. Stop it. That's probably true. All right. All right. Hey, we got 185 people up in here. Hey, everybody need to be smashing that like button. Hey, my lady, Miss Nurse Glamber, a.k.a. Nurse Amber, Miss Enhanced Nursing. You guys don't know who she is. She is also another NCLEX coach, NCLEX strategist. If you guys aren't following her, what are y'all doing with y'all's lives? I need to go over there and follow her. So Derek says, I passed my NCLEX last week. Hold on. How do I screenshot that? Do I do it like that? Did I do it right? I don't even know if I did it right, to be honest. Oh, no, I figured it out. Here we go. I'll figure it out. But Derek, shout out to you. Congratulations. Welcome to the greatest shit show on earth, known as being a. If there's a piece of advice, sir, that you could give to everyone going to take their NCLEX, what would that be? And once again, congratulations to you. You follow her. She's awesome. I love to see it. All right. When are we starting? We're starting right now. All right. So, hey, I told you, if we don't get 100 likes or 1,000 people up in here, we ain't going nowhere. Or 100, 1,000. Y'all know what I'm talking about. Anyway, here we go. Ladies and gentlemen, question number one: a 21-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnosis would be a priority for this client? Is it sexual dysfunction related to radiation therapy, anticipatory grieving related to terminal illness, tissue integrity related to prolonged bed rest, or is it fatigue related to chemotherapy? What are we thinking? What are we thinking? Somebody's telling me A. Okay. A for okay. I like it. Hey, if you guys are new here, welcome. Hey, I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Miss G, I was about to call you Nurse G, but Miss G, thank you for the heart me. Appreciate it. Thank you. All right, what are we thinking, y'all? I'm going to put y'all on a timer, too, because y'all take too long. All right, y'all, here we go. Salute. Here we go in 3, 2. Oh, just kidding. Just kidding. And the answer is A. It is sexual dysfunction related to radiation therapy. Radiation therapy often causes sterility in male clients and would be a primary importance to this client. The psychosocial need of the client are important to address in light of the age and life choices. Hodgkin's disease, however, has a good prognosis when detected early or when diagnosed early. Know the importance of sex to individuals, partners, and patients' motivation for change. Because lymphomas often affect the relatively young who are in their productive years, these people may be affected more than these problems and may be less knowledgeable about the possibilities of change. That's part of physiological integrity. All right. Also part of adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right. So make sure you guys go over there and you check those out for yourself. All right. Remember, you need content, you need Q&A, you need rationale. There's no tricks. There's no games. It's called putting in the fucking work. That's what you need to do. All right. Here we go. Question number 2. A patient with an autoimmune thrombocytopenic purpura, to determine the client's response to treatment, the nurse would monitor which lab value. All right, which one? Not select all apply, but which one specifically? Is it platelet count, white blood cell count, potassium level, or partial prothrombin time? What are we thinking? Hey, if you guys are new here, welcome. Make sure you guys smash that like button. Hey, we're on the road to 10,000 likes. We're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, my throat hurts. Just saying, the weather's changing real crazy around here, so all of a sudden I may not be able to talk. Just saying. And if you're new here, I just want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here? Hanging out with us, trying to get your learn on. All right, y'all, here we go. Thank you guys for the follows. There's so many of y'all that are swiping through. I can't catch you all. So I see Ashley. Shout out to Texas. Araceli, I see you. All right, PTT, I failed at 145. All right, cool. You failed at 145. What are you going to do? Are you going to sit there and are we going to complain about it? Or are we going to find a way to go back and we're going to work? Remember, this test doesn't determine the type of person or nurse that you are going to be. Only you can determine that. So pick yourself up, dust yourself off, and get back into the fight. That's how we do it. All right. First time watching, Robin, I'm glad that you're here. Here we go. But the answer is A. It is your platelet count. Clients with autoimmune thrombocytopenic purpura, or ATP, have low platelet counts, making answer A the correct choice. The laboratory test will show low platelets, usually less than 40 times 10 greater than 9 liters. Hey, look, I don't know how to read labs like that sometimes, but I just know that platelet counts that are low are bad, okay, for over 3 months. So blood film shows large platelets and tiny platelet fragments. Bone marrow examination shows an increased number of, megacardiocytes. All right, that's part of physiological integrity, part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right, so shout out to y'all. Shout out to everybody that got it right. Hey, remember, no one's saying that you need to be an expert and no one's saying that you have to get everyone right, every single one correct. You have to know what everybody else knows. The NCLEX is scored essentially from 0 to 100, and you need a 50 or above. All right. Hey, and the goal is to get to the hard questions. You got to get to the hard questions. That's what the NCLEX wants. All right, critical thinking and to make a critical or a clinical judgment. All right, question number 3. A home health nurse is visiting a client with ATP. The client's platelet count currently is 80. It will be most important to teach the client and family about what? Is it bleeding precautions, prevention of falls, oxygen therapy, or conservation of energy? What are we thinking? 150 to 450. Look at you. Y'all so smart up in here. Y'all so smart. I love it. Also, a little bit about me for those that are new here who don't know. I've been a nurse for 3.5 years. I'm a registered nurse. I have my bachelor's degree if anybody cares about that. I've worked ICU, specifically a burn ICU and a medical ICU. And I worked PACU and I worked OR, and I was in the Navy for 16 years. The last 9 of my 16 years were as a master instructor. I taught in a surgical technology program as well as a whole bunch of other programs. So I appreciate y'all being here, getting y'all's learn on and allowing for me to teach y'all. So shout out to y'all. But here we go. Cool. Here's our answer in 3, 2. CNA going to be an RN? I know that's right. Love to see it. But the answer is A. It is bleeding precautions. A normal platelet count is 120 to 400. Hey, don't get the semantics, okay? Just know that if you start getting lower than 100 and you're like in the night, look, NCLEX is not going to trick you like that. They're not going to be like 149. You know what I'm saying? But they will throw an 80 at you. Be like, whoa, that ain't good. All right. So bleeding occurs in clients with low platelets. The priority is to prevent and minimize bleeding, right? So review lab results for coagulation status as appropriate. So platelet count, prothrombin time, INR, PT, what is it? The APTT and the ACT, all the A's, all the P's, all the C's, all the T's. All right. So make sure, and educate at-risk patients and caregivers about precautionary measures to prevent tissue trauma or disruption of normal clotting mechanisms. That's part of physiological integrity, physiological adaptation, 11 to 17% on the NCLEX, and is the third largest section on the NCLEX exam. Who said something about CCRN? Vega, I don't have any CCRN stuff, honestly. I have a buddy of mine who kind of teaches, but he doesn't. But he does it for his hospital. So he doesn't jump on TikTok and do it. I'm trying to get him to do that. But I personally don't have any CCRN stuff for you. I have a book I can recommend, but I have to tell you that later after this. Question number 4. A client with a pituitary tumor has had transsphenoidal hypophysectomy. Which of the following interventions would be appropriate for this client? All right, so now this is where we need to understand what type of procedure that is and what happens with that. All right. And so now I need to know what is the most important intervention that we are going to do. OK, so I'm going to place the patient or client in T-Berg position for postural drainage. Do I want to encourage coughing and deep breathing every 2 hours, elevate the head 30 degrees, or encourage the Valsalva maneuver for bowel movements? What are we thinking? Shout out to all 300 plus of y'all. We are doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Stop being greedy your whole life. You know what I'm saying? Get carpal tunnel for me right now. My husband has had 6 of these surgeries for pituitary tumors. Oh, no, Kim. Oh, no. Hey, you're saying, hey, he's still alive. So that's what we love to hear. You know, we blessed to see another day. All right, here we go. And the answer is C, elevate the bed or the head of the bed 30 degrees. Elevating the head of the bed 30 degrees avoids pressure on the sella tunica and alleviates headaches. A, B, and D are incorrect. That's obvious, right? In the immediate post-procedure or post-operative period, patients are monitored in an ICU unit with monitoring for neurological deterioration, epistaxis, visual dysfunction, diabetes insipidus, and hypotension secondary to acute hypocortisolism. All right. Once again, that's part of physiological adaptation. With physiological adaptation, it's all about knowing your pathophysiology, the disease processes, the procedures, all those good things and how they affect the body. All right. I was in the Navy for 16 years. I got out just past January. So 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. All right. So shout out to everybody that got that question right. And if you don't know, circle back, get the content. All right. There are no tricks to taking the NCLEX. It's called putting in the work. That's what it's called. It says, is this for RN or LPN? Do you have any LPN? It doesn't matter. It doesn't matter. This is both for RN and LPN. The biggest thing that you need to know about being an LPN or taking the LPN NCLEX is knowing what you can and can't do and what you can and cannot accept. You learn the same exact content. This same exact content that an RN, ADN, or a BSN RN would learn. So there you go. Question number 5. The client with a history of diabetes insipidus is admitted for polyuria, polydipsia, and mental confusion. The priority intervention for this client is what? Is it measure the urinary output, check vital signs, encourage increased fluid intake, or weigh the patient? What are we thinking? What are we thinking? And the great thing about this when you guys are practicing is as you're going through your practice questions, you'd be so surprised to answer one question and then 5 or 6 questions down the line, there's another question related to something you already answered. All right. So be aware of that. Be all in when you're doing your studying. OK. All right. Assess the patient first. So it's B. OK, B, A. All right. Well, let's see what the answer is. Here we go. In 3, 2, And the answer is B. We want to check vital signs, right? A large amount of fluid loss can lead to fluid and electrolyte imbalance. That should be corrected. The loss of electrolytes would be reflected in the vital signs. So you want to monitor for signs for hypovolemic shock, which will show tachycardia, tachypnea, and hypotension, which is low blood pressure. Frequent assessment can detect changes early for rapid intervention. Polyuria causes decreased circulatory blood volume. That's part of physiological integrity. Adaptation, third largest section on the NCLEX exam at 11 to 17%. All right. So, by the way, if you got this answer wrong, go and read your rationales of why it is incorrect. I don't care if you agree with it or not. It's going to tell you why it's incorrect. Now, disclaimer, some of these are incorrect. And you better go prove to yourself why it's incorrect. But the majority of them, a good amount of them, all of them, except for a few, they're all correct. All right. So that's how you learn and that's how you're able to retain. All right. Ladies and gentlemen, somebody said something about a smudge lug. I'm trying right now. OK, ladies and gentlemen, right. Real quick. I got a free download for you guys. You guys can go over there and check that out. It's test taking tips on how to conquer the NCLEX. All right. 42 pages. 42. All right. That's one more than 41, one less than 43, but 42 pages of just deliciousness minus the fanny pack. Everybody should get one. Anyways, so make sure you guys go over there and check that out. That link is in my bio and it is also right there on the screen for you. bootnurse.com/test. It's free. You guys go over there and check it out. You know what I'm saying? Who doesn't like free, right? But here we go. Question number 6. A client with hemophilia has a nosebleed. Which nursing action is most appropriate to control the bleeding? All right. Not what your mom taught you on how to do when you guys got nosebleeds at home, but what is the proper way to control a nosebleed? Is it place the client in a sitting position with the head hyperextended? Is it pack the nares tightly with gauze to apply pressure to the source of the bleeding? Is it to pinch the soft lower part of the nose for a minimum of 5 minutes? Or is it apply an ice pack to the forehead and to the back of the neck? What are we thinking? What are we thinking? Somebody said something about there being a smudge on the screen. I mean, I think I wiped it off. Hey, this is an old phone, so it could be a permanent smudge. Who knows? Or maybe I'm just too lazy to clean it off. We'll figure that out soon, though. Hey, but if you guys are new here, welcome. We got these questions off nurseslabs.com. Make sure you guys like, you guys share. Just zoom out. Let me see if I can zoom out. Can I do that? Nope, can't do it. That's as far out as I can go. Or, here, I'll do this. I'll make this smaller. I don't like that. It looks weird. Looks weird to me. All right, here we go. Here we go. Here's our answer in 3, 2. And the answer is C. We want to pinch the soft lower part of the nose for a minimum of 5 minutes. The client should be positioned upright and leaning forward to prevent aspiration of blood. Usual sites of external bleeding may include the bleeding in the mouth from a cut, bite, or from cutting or losing a tooth, nosebleeds for no obvious reason, heavy bleeding from minor cuts, or bleeding from a cut that resumes after stopping for a short time. Hemophiliacs do not bleed faster or more frequent. Instead, they bleed longer due to the deficiency of clotting factors or clotting factors. Clients are often aware of bleeding before clinical manifestation. Bleeding can be life-threatening to these clients. All right. So shout out to everybody that saw this. You saw this on Archer. Hey, so what does that tell you, Ty? If you saw it on Archer, there's only so many ways that you can write a question. There's only so many ways that you can write a question. All right. So you'd be so surprised on where you would see them. But shout out to everybody that got that question right. If you didn't get it right, read your rationales, circle back, get your content, keep doing your questions, keep doing your answers. All right. So who said this? Terrence said this is awesome. Terrence, I'm glad that you think this is awesome. I appreciate that. Here we go. Question number 7. A client has had a unilateral adrenal ectomy to remove a tumor. To prevent complications, the most important measure in the immediate post-operative period for the nurse is to take what? Is it a blood pressure, temp? Is it output or urine gravity? What are we thinking? What are we thinking? Shout out to everybody that's here. Hey, I want to know who you are, where you're from, and where you're at in your nursing journey. Hey, we're on the road to 10,000 likes. You know what I'm saying? I'm sitting at like 9.9K. I don't know what's up with that. Nurse Mix, thank you for the rose. I appreciate you. Blood pressure. Somebody said infection. Where do you see infection as an answer choice? 4 weeks in my first term. Love it. Daughter will Taka McAfee. What? Shout out to Uganda, Louisiana. I see you. Rad Tech. I love my radiology techs. I saw this on UWorld. Cool. Like I said, there's only so many ways. Shout out to H-Town. I live in San Antonio, so shout out to all my Texas people. San Antonio in the house. But here we go. Here is our answer. Shout out to Kenya. I see y'all. But the answer is B. It is a blood pressure. Blood pressure is the best indicator of cardiovascular collapse in the client who has had an adrenal gland removal or adrenal gland removed. All right. The remaining gland might have been suppressed due to the tumor activity. Primary adrenal insufficiency occurs after bilateral adrenalectomy. Signs and symptoms are volume depletion, hypotension, hyponatremia, hyperkalemia, fever, and abdominal pain. Patients are managed by replacement therapy based on glucocorticoids, mineral corticoids, in cases of confirmed corticoids or aldosterone deficiency, respectively. All right. Physiological adaptation, third largest section on the NCLEX exam at 11 to 17%. All right. Boca Raton, Florida. I'm going to be there in July. So they kind of rich out there. I'm just letting y'all know. They rich in Boca Raton. You know what I'm saying? So shout out to y'all. Priscilla said, just took my NCLEX this morning. Love it. Love it. How different is the new version? The new version of the NCLEX is not much different from the old version. The thing that's different inside of the new generation NCLEX is the fact that they give you case studies. And you could have a good majority of your test be based off of a case study. I like case studies because they give you all the information you could ever want inside of your question to include the lab values, but you have to be able to interpret those lab values. All right. It says, yeah, very expensive. I know that's right. They got a lot of rich folks that's out there. Question number 8, a client with Addison's disease has been admitted with a history of nausea and vomiting for the past 3 days. The client is receiving IV glucocorticoids or Solumedrol. Which of the following interventions would the nurse implement? All right. So is it daily weights? Is it intake and output measures, sodium and potassium levels monitored? Or is it a glucometer reading as ordered? What are we thinking? So think about, what does a glucocorticoid do? Right? What does a glucocorticoid do? And it's Solumedrol. So what are the signs and symptoms of, or what is the expected outcome that you should see with somebody who is on Solumedrol? These are the questions that you have to ask yourself every single time. When you are answering a question, it allows for you to activate your critical thinking, which is what the boards want. So you can make a safe clinical judgment, right? Because we're all about safety. That's what we want. But here's our answer in 3, 2, is it D? I don't know, Marissa, we finna find out. But the answer is D. It is the glucometer reading as ordered. IV glucocorticoids raise the glucose levels and often require coverage with insulin. Cortisone and prednisone replace cortisol deficits, which will promote sodium reabsorption. The fludrocortisone is a mineral corticoid for patients who require aldosterone replacement to promote sodium and water replacement. Acute adrenal insufficiency is a medical emergency requiring immediate fluid and corticosteroid administration. If treated for adrenal crisis, the patient requires IV hydrocortisone initially. Usually by the second day, administration can be converted to an oral form of the replacement. Physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. I graduate in July. I graduated in July from my LVN program, and I'm scared of the NCLEX. So you're scared? Marissa, you mean to tell me you're scared of a computer and a program that don't got no type of emotional type of feeling towards you? Here's what I'm going to tell you. You are exactly who you think you are when it comes to taking this exam. You are a smart individual. You are intelligent, and you know this material. Trust and believe me when I tell you that. All right. Hey, look, I'm working on a bunch of stuff. You know, shout out to Amber. If you guys don't know who Nurse Amber is, I'm just letting you know she lets y'all know what the deal is. All right. But I'm letting you know you are as smart as you think you are. You know this information. All you need to do is apply it. And all you need to do is keep practicing. Know thy enemy. We know what the NCLEX looks like. All right. So make sure you go out there and you keep pushing. All right. Don't be scared of something you ain't never been a part of like that. All right. Here we go. Question number 9. A client had a total thyroidectomy yesterday. The client is complaining of tingling around the mouth and in the fingers and toes. What would the nurse's next action be? So in this systematic approach, steps 1, 2, 3, and 4, what would be step number 2 after number 1, right? Is it obtain a crash cart, check the calcium level, assess the dressing for drainage, or assess the blood pressure for hypertension? What are we thinking? What are we thinking? Remember, don't forget ADPI, right? Don't forget the nursing process, right? Do we have enough information in order for us to do something? Do we need more information? These are the questions that you have to ask yourself. All right. Shout out to all of y'all. Y'all got me to 13,000 likes. Hey, get me to 20,000 likes. Y'all stop playing games on this Wednesday. You know what I'm saying? But here is our answer in 3, 2, and the answer is B. Check the calcium level, right? Shout out to everybody that picked answer choice B. I had a thyroid. Jordan, that's cheating. That's okay, though. Shout out to you, Jordan. The parathyroid glands are responsible for calcium production and can be damaged during a thyroidectomy. The tingling is due to low calcium levels. Evaluate reflexes periodically. Observe for neuromuscular irritability, twitching, numbing, paresthesia. Check Chavastex and Trousseau signs and signs of seizure activity. That's part of physiological adaptation, which is 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. So shout out to y'all. It says, got damage and my lip tingle. Hey, look, it happens. That's part of the side effects, right? I'm in PA school, but I love your lives. Diamond, I love that you love this. Shout out to you being in PA school. Two of my buddies actually just graduated, I want to say last year, August, and they're doing their thing. So shout out to y'all. But here we go. Question number 10. A 32-year-old mother of 3 is brought to the clinic. Her pulse is 52. There is a weight gain of 30 pounds in 4 months, and the client is wearing 2 sweaters. The client is diagnosed with hypothyroidism. Which of the following nursing diagnosis is of highest priority? Is it impaired physical mobility related to decreased endurance? Is it hypothermia related to decreased metabolic rate? Is it disturbed thought processes related to intestinal edema? Or is it decreased cardiac output related to bradycardia? What are we thinking? Hey, if you guys are just now joining, welcome. We're doing NCLEX questions. These are both for RNs and LPNs, and I got them off of nurseslabs.com. You guys can check that website out for yourself. But also, I want to know who you are, where you're from, and where you're at in your nursing journey. A little bit about me. Been a nurse for almost 4 years. Worked ICU, OR, and PACU. I was in the Navy for 16 years, and I failed my NCLEX 3 times. Not once, not twice, 3 times. Shocker, right? So I failed my NCLEX 3 times. So here's what I'm going to tell everybody that's going to take that NCLEX, or if you're a repeat test taker. Nobody cares how you feel about it. What you need to do is that you got to pick yourself up. You got to dust yourself off, and you got to keep pushing. You want to know what? You want to know who's never going to ask you? Your job and your client or your patients. They're never going to ask you that. All right. Hey, let me tell you something right now. And people that tell you to go do something else if you fail this exam, get rid of them. They don't need to be anywhere near you. You see what I'm saying? If you're destined to be a nurse, you're going to make it happen. So I'm telling you right now, if you failed your NCLEX or if you're scared, go to church. But then guess what? You're going to do that scared too. So go out there and this is how you become what you want to become. All right. If it was easy, everybody and their mom would do it. All right. So get out of your own way. Get out of your own way. And the answer is D, decreased cardiac output related to bradycardia. The decrease in pulse can affect the cardiac output and lead to shock, which would take precedence over the other choices. Protect against coldness. Okay. Provide extra layers of clothing or extra blankets, and discourage and avoid the use of external heating sources. Monitor patient's body temperature, physiological integrity, adaptation. Third largest section on the NCLEX at 11 to 17%. All right. So shout out to everybody. Shout out to everybody who got that answer right. And if you got it wrong, hey, circle back, get the content, keep doing your questions and answers, and make sure you read your rationale. All right. I'm a medical assistant currently going to something. Mark Klimek is cool. You can find his review. It's updated and all that stuff if you go to like markklimek.com, something like that. All right. So, but ladies and gentlemen, I have an ebook. All right. And guess what? The path to conquering the NCLEX begins with you. You can blame your school all you want, just like I did, and continue to fail. Or you can, grab life by the horns, figure out what you didn't do right, and then improve upon it. That's the only way that we get better. And why? Because that's what we do. And anybody interested in checking out this book, look, we got EKG interpretations. We got pharmacology in there. Got some management delegation questions. We got all kinds of stuff in there. Over 700 pages, y'all. Y'all can check that out at thebootnurse.com/victory, as well as you can check the link in my main page, in my link tree. It'll show you how to get there as well. What's up? Oh, my God. Hey, y'all, Jell is here. Everybody be quiet. Don't nobody say nothing. Jill once, hey, by the way, Jill once told me that I read monotone, so I'm just gonna read it like how she wants me to read it. All right, here we go. Um, the client is having an arteriogram. During the procedure, the client tells the nurse, "I'm feeling really hot." Which response would be best? Is it A, you are having an allergic reaction? I will get an order for Benadryl. That feeling of warmth is normal when the dye is injected. That feeling of warmth indicates that the clot is in the coronary vessels are dissolving. And I will tell your doctor and tell him exactly, or tell him to explain to you the reason for the hot feeling that you're experiencing. What is your answer? Oh, okay, my bad. All right, see, that's what you get, Jill. Hey, as a matter of fact, give me the 30,000. Hey, I just want to let y'all know that was difficult for me to do. Like, I'm over here smiling the whole time. That was very difficult for me to do. It's too close. It's cutting off words. Hey, look, I can't back it up any further. If I back it up any further, it's not gonna work. It's not gonna work. I could make it smaller, but then, I don't really like the way that looks. It looks kind of funky to me. See something. All right, we kind of keep it like that. Whatever. All right, here we go. Here we go. And that's better? Okay, cool. That looks better? Okay, fine. Whatever. I guess I got to make y'all happy too. Jeez. Anyways, the answer is B. That feeling of warmth is normal when the dye is injected. It is normal for the client to have a warm sensation when the dye is injected. The client may have some discomfort from a needle stick. He or she may feel symptoms such as flushing in the face or other parts of the body when the dye is injected. The exact symptom will depend on the body part of the body that's being examined. That's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. We cannot read? What you mean you can't read? I thought we all went to school and we all learned how to read. I'm just kidding. Hold on. Hold that. Read? What you mean you can't read? I thought we all went to school and we all learned how to read. I'm just kidding. Hold on. Hold that thumb. Small. I'm trying to make that work. Being cut off too much on the left. Look, all right. I don't even know. I don't know what y'all want from me. I know what y'all want from me. Okay. I'm trying to make it work. And remember, by the way, if you guys are new here, I'm on a new phone. So I'm on a different phone. So, like that's what I got. I'm just going to keep it like that. Come on, man. Look. Hey, when you get shit for free, guy, look, I'm trying to make it work. Here we go. Question number 12. The nurse is observing several healthcare workers providing care. Which action by the healthcare worker indicates a need for further teaching? So this healthcare worker is doing something incorrect. So how do we fix that healthcare provider? All right. So is it the nursing assistant wears gloves while giving the client a bath? The nurse wears goggles when drawing blood from the client. The doctor washes his hands before examining the client, or the nurse wears gloves to take the client's vital signs. What are we thinking? Hold on. What did you say? Oh, man. Hey, by the way, hold on. Let me see. It says, if you can't see, hit the X on the top right corner. It fixes it. You talking about me? Terrence, is the X on the top right of the corner? Does it get you out of the live? Is that what I'm picking up? Oh my goodness. Nope, the viewers. Oh, okay. I got you. I'm tracking. Hey, but if you guys are new here, welcome. We're doing NCLEX questions. We're on the road to 30,000 likes, so make sure you guys smash that like button, you guys share, and you guys follow. And I also want to know who you are, where you're from, and where you're at in your nursing journey. But here we go. Here is our answer in 3, 2, and the answer is D. The nurse wears gloves to take the client's vital signs. It is not necessary to wear gloves to take the vital signs of a client. If the client has an active infection such as MRSA, gloves should be worn. Washing hands or performing hand hygiene before having contact with the patient. Also, impart these duties to the patient and their significant others. Know the instance when to perform hand hygiene or 5 moments for hand hygiene. All right. Hey, wash your hands. You nasties. Wash your hands. All right. Wash your hands, you nasties. I don't like that. You don't like that question. Why? Because you don't wash your hands. You're nasty. You know what I'm saying? But here's the thing. Like in reality, when you do vital signs, you do not have to wear gloves. You don't have to wear gloves, right? Now, if somebody has an infection, absolutely, you have to wear gloves. Like it doesn't matter what they have going on. But a normal person, you don't need gloves to take vital signs. You don't. Per the literature. You can wear gloves, but NCLEX is saying you don't have to wear gloves. Hey, listen, okay? I'm just letting you know. I'm just letting y'all know. Here we go. Question 13. The client is having electroconvulsive therapy for the treatment of severe depression. Which of the following indicates that the client's ECT has been effective? Is it A, the client loses consciousness, the client vomits, the ECG indicates tachycardia, or the client has a grand mal seizure? What are we thinking? Shout out to you being in your third semester. I didn't see your name. I'm sorry. Hey, if you guys are new here, welcome. I was fixing the PowerPoint so I don't get yelled at by people. So, there's that. So shout out to all y'all. By the way, these are NCLEX questions from nurseslabs.com. They are free sets of questions for both RNs and LPNs. Hey, if you don't like my live, you can go over there by yourself. You know what I'm saying? You can go over there by yourself and check that out. But yeah, let's see what this answer is. Prerequisites. Shout out to you, Nat. Hey, prerequisites. Hey, you're going to be a nurse before you know it. It's going to fly by so fast. Here we go. Here's our answer in 3, 2. And the answer is D. The client has a grand mal seizure. All right. During ECT, the client will have a grand mal seizure. This indicates completion of electroconvulsive therapy. Seizure threshold is established via trial and error via incrementally higher doses of current during the primary treatment session. Following initial dose calculation, the dose of subsequent ECT sessions for bilateral ECT is 1.5 to 5 times seizure threshold, and for right unilateral is 6 times the seizure threshold. Right? During the course of ECT treatment, the seizure threshold commonly increases as the patient develops tolerance. All right, that's physiological. Adaptation, 11 to 17% on the NCLEX, making it the third largest section. You got your pending on May 2nd. Ty, I'm going to be there. I'm not going to be there. I'll be there in spirit, though. Trust and believe me. Trust and believe me. I'll be there for you. All right. But hey, you should just put it on TikTok Live so we can all follow you when it happens. All right. Everybody should do that. Be proud of that moment. All right. But hey, if you didn't get this question right, make sure you circle back, get the content, get the questions, get the answers and the rationales. Cheyenne says, my opinion is also Cheyenne. Ain't nobody ask you. I'm just playing, Cheyenne. I'm just playing. I'll be there too in spirit. All right, here we go. Question number 14. A 5-year-old is being tested for pinworms. To collect a specimen for assessment of pinworms, the nurse should teach the mother to Cheyenne. I'm just playing. All right, but we should teach the mother to what? Is it examine the perianal area with a flashlight 2 or 3 hours after the child is asleep? Is it to scrape the skin with a piece of cardboard and bring it to the clinic? Is it obtain a stool specimen in the afternoon, or bring a hair sample to the clinic for evaluation? What are we thinking? Hey, if you guys are new here, welcome. Hey, we're on the road to 30,000 likes. 30,000 likes. Hey, we're at question 15. All right. We could stop at 20. We could stop at 30. We could stop at 50. Last week we stopped at like 40. So I need carpal tunnel. I need it for me. I need 1,000 people up in here. Stool sample. All right, cool. All right, what are we thinking? 10 more seconds. They come out at night. Tape test. Okay. All right. A, because the pinworm shows up at the dark and sometimes like that. Okay. All right. But I mean, yeah, stool. Okay, I got you. Tape test, yeah. All right, well, let's see what the answer is. Let's see what it is in 3, 2. And the answer is A, examine the perianal area with a flashlight 2 to 3 hours after the child is asleep. Infection with pinworms begins when the eggs are ingested or inhaled. The eggs hatch in the upper intestine and mature in 2 to 8 weeks. The females then mate and migrate out of the anus, right? Where they lay up to 17,000 eggs. Wow. Hey, those are some squatters like I ain't never seen. Anyways, this causes intense itching. The mother should be told to use a flashlight to examine the rectal area about 2 to 3 hours after the child is asleep. Placing clear tape on a tongue blade will allow the eggs to adhere to the tape. The specimen should be brought in to be evaluated. All right. So shout out to everybody that got that question right. That's part of physiological adaptation or physiological integrity, which is 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. Remember, management of care, pharmacology, physiological adaptation, reduction of risk potential are the 4 largest sections that they will pull questions from. Those sections alone make up more than half of the NCLEX. All right. So shout out to you. We've had this question before. Yep, you sure have. Here we go. Question number 15. The nurse is teaching the mother regarding treatments for, the arteriobiasis, right? Which I believe was the pinworms, right? Which instructions should be given regarding the medication? It says treatment is not recommended for children less than 10 years of age. The entire family should be treated. Medication therapy will continue for a year, or intravenous antibiotic therapy will be ordered. What are we thinking? What are we thinking? Hey, also, if you guys are new here, welcome. A little bit about me. I've been a nurse for almost 4 years. It'll be 4 years in June. Worked ICU, OR, and PACU. I was in the Navy for 16 years, and I failed my NCLEX 3 times. So I failed my NCLEX 3 times. I passed it on the 4th. Been a nurse for almost 4 years. My patients never asked me. My jobs never asked me. When people found out, they were surprised because it didn't matter. It did not matter. All right, because I didn't let that test determine what type of nurse I was going to be. Only I can do that. All right, so get out of your own way, get out of your own head, put in the work, and get that license. I just graduated, waiting for my NCLEX date. Love it. What did you do? What did you do the 4th go around? Look, it's a synopsis. It's a synopsis. So many things that I had to do. One thing I had to do is I had to change. I literally had to change my entire environment at that point. Cut people off, realize that all these people that are around me aren't for me in regards to making sure of getting what I needed to get done. I recreated the testing center, time management, accountability, a different support system, you name it. All right. So what is it? It's pinworms are treated with, Vormox and the anti-minith. Right? The entire family should be treated to ensure that no eggs remain, because a single treatment is usually sufficient. There is usually good compliance. The family should be tested again in 2 weeks to ensure that no eggs remain. That's part of physiological adaptation. Integrity, 11 to 17% on the NCLEX, making it the 3rd largest section on the NCLEX exam. I want to be that level of smart. What do you mean? What do you mean you want to be that level of smart? What do you mean? Oh, I see CC in there saying something. CC, I didn't see what you said. I'm sorry. Here we go. But ladies and gentlemen, I have an NCLEX course that you guys can check out right now. You can join the 7-day NCLEX course for $7. Yeah, that's $1 more than 6, one less than 8. You can join it for $7. It's on a subscription base, but for $7, you get it for 7 days. And you can check out both NCLEX reviews that I have in there. One's a new generation NCLEX review. Another one is an NCLEX review broken down by the NCLEX test plan. So management of care, pharmacology, physiological adaptation, so on and so forth. And you guys can check that out. All right. Plus some content videos. There's over 70 videos that are in there right now. All right. So you guys can go over there and check that out. That link is also in my bio, or you guys can go to thebootnurse.com/special and check that out. And then you guys can be a part of the community as well, where I do live sessions, so on and so forth. All right. So make sure you guys go over there and check that out. Jill, don't be making those eyes like you didn't know that. Okay. Don't do that. Don't do that. Don't act like you ain't been here before. Okay, so here we go. Question 16. The registered nurse is making assignments for the day. Which client should be assigned to the pregnant nurse? All right, so I'm a nurse making an assignment for, and by pregnant nurse, I mean the pregnant nurse is one of the staff members. All right, so what patient should I give to this pregnant staff nurse? All right. Is it a client receiving a linear acceleration radiation therapy for lung cancer? Is it a client with a radium implant for cervical cancer? Is it a client who has been administered a soluble, brachytherapy for thyroid cancer? Or is it a client who returned from placement of, iridium seeds for prostate cancer? What are we thinking? What are we thinking? Shout out to all y'all. Turn this up soon. Turn the brightness up. Turn all the brightness up. Shout out to all 197 of y'all. We are doing NCLEX questions. If you guys are new here, welcome. These are both for RNs and LPNs. C for 500, Alex. Oh, my God. Every time. I pray all the time. But, Lord, you don't be answering my prayers, because this one right here be testing me. She just called me Alex. Here we go, ladies and gentlemen. Here, who gave me that? Who gave me that heart? Eliza, thank you for the hand heart. I appreciate you. All right, here we go. Here's our answer in 3, 2. And the answer is A, the client receiving a linear acceleration radiation therapy for lung cancer. The pregnant nurse should not be assigned to any client with radioactivity present. The client receiving linear accelerator therapy travels to the radiology department for therapy. Oh no, the radium department. That's Rad Health. Sorry. The radiation stays in the department, so the client is not radioactive. These clients are radioactive in very small doses, especially upon returning from the procedure. For approximately 72 hours, the client should dispose of urine and feces in special containers and use specific spoons and forks. That's part of safety. That's part of safety and infection control, even though that's under safe and effective care environment. Y'all, that's where it is. That's where it is. No, I knew it. You knew it, but you picked the wrong answer. So here's the thing. Remember, ladies and gentlemen, RTFQ, RTFA, and then RTFR. Who can tell me what they stand for? All right. But hey, if you didn't understand this aspect when it comes to cancer, start going and looking at oncology sections. All right. So that way you can get a little bit more familiar with that. But shout out to everybody that got that right. And if you got it wrong, circle back. All right, here we go. Question number 17. The nurse is planning room assignments for the day. Which client should be assigned to a private room if only one is available? All right, the client with Cushing's disease, the client with diabetes. All right, is it a client with acromegaly or is it a client with mixed edema? What are we thinking? Who said, is it Only? Is it only live once? Oh, you only live once? First of all, girl, look, we're going to have a conversation about your name. All right. I'm glad. First of all, I'm glad you're learning a lot, but I literally had to decipher that like if it was the Da Vinci Code and I ain't like that. But what are we thinking? Shout out to everybody that's in here. We're doing NCLEX questions. If you guys are new, welcome, welcome, welcome. Make sure you guys like, make sure you guys share, make sure you guys follow. That is the trifecta that TikTok wants. And I need that, all that. And by that, I mean, I want you to get carpal tunnel for me. Queen says C. Jill says IDK. First of all you have to say is D. You don't have to put an I and a K there because those letters aren't there. My God. My God. Here we go. Here's our answer in 3, 2. And the answer wasn't I, D, or K, but it was A. The client with Cushing's disease. There we go. Yup. The client with Cushing's disease has adrenocortical hypersecretion. This increase in the level of cortisone causes the client to be immunosuppressed. Okay, so high cortisol levels also cause immune disruption. This hormone leads to a decrease in lymphocyte levels and increases the neutrophils. It causes detachment from a marginating pool of neutrophils in the bloodstream and increases the circulation of neutrophil levels, although there is no increased production of the neutrophils. That is part of safe and effective care environment, which is also part of management of care. Right? So I want to know assignment, delegation, supervision, and also can be a part of safety and infection control. All right. It says they're at risk for infection. There you go. Right. Because they're immunocompromised. There you go. For sure. So shout out to everybody that got that right. And if you got it wrong, you know what to do. Circle back, get the content. All right. Get the content. All right. Question number 18. The nurse caring for a client in the neonatal intensive care unit administers adult strength digoxin to a 2-pound infant. Oh my God. As a result of her actions, the baby suffers permanent heart and brain damage. The nurse can be charged with what? Is it negligence, tort, assault, or malpractice? RTFQ, you know what the deal is. All right. Hey, I just want to let y'all know this is huge when it comes to medical administration. Y'all, everybody should know the story of Redonda Vaught, right? Where she gave somebody vecuronium instead of Versed, ended up killing that patient. Ended up that patient no longer being with us. All right. So medical administration, pharmacology is important, ladies and gentlemen. It is huge. It is huge because you are responsible for somebody's life. You're responsible for somebody's life. All right. Everybody's telling me D. I'll give you guys 10 more seconds. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys like, share, and follow. That is a trifecta that TikTok needs. And I need that. Get carpal tunnel for me. Give me 30,000 likes. Give me 30,000 likes. All right, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is D. It is malpractice. The nurse could be charged with malpractice, which is failing to perform or performing an act that causes harm to the client, giving the infant an overdose, falls in this category. In the United States, a patient may allege medical malpractice against a clinician, which is typically defined by the failure to provide the degree of care another clinician in the same position with the same credentials would have performed that result in injury to the patient. That's part of safe and effective care environment. Hey, listen, that's a pharmacology question on top of reduction of risk potential, right? That's huge, ladies and gentlemen. By the way, if you want to understand why you got it wrong, go back and read it. Go back and read the question, right? RTFQ. What other nurse was criminally charged, though correct? What do you mean? I just know Redonda. There's been plenty of people that have done stuff like that, like where they'll give them a nurse bump dose of insulin. For whatever reason, there's a guy who did that he was like a 20-year nurse or whatever and was overdosing people on insulin. So it's out there. And I'm telling you right now, the board don't care about what policies you guys have at your hospital. They will take that damn license. Trust and believe me. RTFQ means to read the fucking question. You must be new here. So if you don't like the F word, I'm sorry. I'm a sailor at heart, and I'm also a nurse, so the F word is my favorite word. So, and it's going to be your favorite word, too, if you don't already say it. So I'm just letting you know. All right, question 19. Which assignment should not be performed by the licensed practical nurse? All right, so LPNs, you need to know what you can and can't do and what you can and can't accept. RNs, you need to know what they can and can't do and what you can and cannot give them. All right, so can an LPN do a Foley? Can an LPN discontinue a nasal gastric tube? Can an LPN obtain a sputum sample? Or can an LPN start a blood transfusion? So which one can they not do? It says not a pirate, the captain. Stop it. All right, y'all. Arr. All right, y'all. How y'all doing? How we doing? Hey, if you're new here. No, hold on. Who said that? Hold on. It says monitoring a blood transfusion okay, but not to start. Okay. All right. Gel, there's only one D here. There's only one. Why you give me 4? Oh my God. There's always something with you. Always something. Here we go. Here's our answer in 3, 2. And the answer is starting a blood transfusion, which is D. The licensed practical nurse should not be assigned to begin a blood transfusion. An LPN works under the supervision of doctors and RNs performing duties such as taking vital signs, collecting samples, administering medications, i.e. PO and IM medications, not IV, right? Ensuring patient comfort and reporting the status of their patients to their nurses as part of safe and effective control or safe and effective care environments. Management of care type of question, delegation, supervision, and assignment type of question, right? That's what you guys have to know. You need to know what you can and can't do and what you can and cannot accept. Look, LPNs cannot start blood transfusions. They cannot do anything with PICC or central lines. They cannot do IV medications. They cannot take unstable patients. You need to know that. A little quicker, please. How about not? You must be new here. I go at my speed, and if you don't really like it, sorry. Here we go. Question number 20. All right. It says LPNs will IV certified. I didn't ask you. The boards does not care if you are IV certified. They and the boards won't even ask you that question. They're going to be like, hey, you have an LPN who's IV certified. They won't ask you that question because it's based on state to state. So I'm not saying that you don't do IVs, but according to the National Council of State Boards of Nursing, which is a national exam, it does not allow for you to do that. Now, your state regulates the nurses and you can do that. But on a board, on a national exam, it does not. OK, just to clarify. I'm reading too deep. I don't know. You're too aggressive. What you mean I'm too aggressive? Sorry. It's not that deep. No. So it is that deep because people don't know their scope of practice. So when you have people that are in here who don't know the differences and then you start saying, oh, I can do this. I'm like, no. You can't do that. And it's not about me being aggressive. It's about me being honest. So, hey, I'm out here to give the right information. If you don't like it, sorry. I don't know what you want me to tell you. But question number 20, the client returns to the unit from surgery with a blood pressure of 90/50, a pulse of, it is that deep. That's what I'm trying to tell you. A pulse 132 and a respiratory rate of 30. Which action by the nurse should receive priority? Is it continue to monitor the vital signs, contact the physician, ask the client how he feels, or ask the LPN to discontinue or to continue the post-op care? Look at that. You said that wrong? Oh, okay. Who said that? Jenny? All right, cool. Here we go. I've been on this question for a minute. But the answer, of course, is B, contacting the physician. The vital signs are abnormal and should be reported immediately. The early detection of changes in vital signs typically correlate with faster detection of changes in the cardiopulmonary status of the patient, as well as gradation of the level of service if needed. Patient safety is a fundamental concern in any healthcare organization, and early detection of any clinical deterioration is a paramount importance, whether the patient is in the emergency department or on the hospital floor. Physiological integrity or adaptation, 11 to 17% on the NCLEX exam, which is the third section on the NCLEX exam. Who said that? Abedino says, I passed my NCLEX 86 credits. Thank you, Kevin, for your live reviews. Nurse, hey, shout out to you. Hey, you're like the third person to come in here to tell me you passed your NCLEX. Abedino has been a frequent flyer, so sir, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse, whether you're an RN or an LPN. All right, and if there's a piece of advice that you could give to everybody, what advice would that be? And once again, sir, congratulations to you. So $7 for 7 days is the only one you offer. So I have a free download that's over there. I have an ebook that's over there, and the $7 for 7 days is the self-paced on-demand NCLEX course. So yeah, that's all I offer right now. So here we go. But anyways, ladies and gentlemen, I'm writing a book. I have a book right there, Conquer It, my journey to passing the NCLEX. Why? Is because people need to know. People need to know the story and realize that they need to get out of their own way. They need to get off of their beach, and you need to progress forward. Stop letting this exam hold you back when it has no type of emotional respect or ties to you. Get out of your own way. And that's what this book is going to be about. It's going to talk about my failures and then what I did in order for me to conquer the exam. I learned from my past mistakes. Hey, and it's an award-winning author. Hey, look. I got the thing right there. It's going to be award winning. Trust and believe me. But check that out at thebootnurse.com/books, or you guys can find that link in my bio as well. Oh, it's on hold. Oh, it's holding me. Oh, it's holding you back. You better tell it to let you go. All right, here we go. Question number 21. Which nurse should be assigned to care for the postpartum client with preeclampsia? Okay. Is it an RN with 2 weeks of experience in postpartum, RN with 3 years of experience in labor delivery, RN with 10 years of experience in surgery, or is it an RN with 1 year experience in the neonatal intensive care unit? What are we thinking? It's holding me back too? Come on, Jenny. Come on, Jenny. Don't let it hold you back. All right. Here's the thing is that if you failed your NCLEX, you get a candidate performance report. Everybody does. I have 3 of them. Right. So what I'll say to you is go and look at that performance report and see where you got below passing, and then that is where you start. So if pharmacology is it, start looking at pharmacology lectures. There's the game for you, all right? Here we go. Here's our answer, ladies and gentlemen, in 3, 2, and the answer is B. It's the RN with 3 years of experience in labor and delivery, right? So the nurse with 3 years of experience in labor and delivery knows the most about possible complications involving preeclampsia. Registered nurses need to know their rights and responsibilities when considering a patient assignment. The nurse-patient assignment process is also often a manual process in which the charge nurse must sort through multiple decision criteria in a limited amount of time. That's part of safe and effective care environment, which is part of management of care, right? Because this is an assignment, delegation, and supervision type of question. Okay. So here's what I'll tell you in regards to that is if they try to give you an assignment that is not within your scope of practice, you never take it. Don't you ever take it, especially if you're a med-surg nurse and they send you to ICU, but you've never had any experience doing titrated drips. You better never, ever take that patient ever. Kevin, I read that wrong. So what did you do? How often do I do these? Monday, Wednesday, Friday, 5:30. All right. He says, I am terrified. You want to know the best way that you can overcome being terrified? Recreate the testing center. Question number 22. Which information should be reported to the State Board of Nursing? The facility fails to provide literature in both Spanish and English. The narcotic count has been incorrect in your unit for the past 3 days. The client fails to receive an itemized account of his bills and services received during his hospital stay, or the nursing assistant assigned to a client with hepatitis fails to feed the client and give the bath. What are we thinking? What are we thinking? Shout out to all 150 of y'all. We're doing NCLEX questions. Hey, y'all give me the 30,000 likes. Make it happen. Make it happen. If you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. All right, everybody's telling me B. Everybody is telling me B. It says, I want to say D, but I'll go with B. Do you want to say D because that's what your gut feeling is? Or do you want to say B because you're following the herd? Which one? Just let you know this herd is not going to be there with you in your NCLEX. So if you get it wrong, that's okay. I'd rather you get it wrong here than not get it wrong somewhere else, Going against the grain? Okay. First choice was D. Okay. Go with your gut answer. And if you get it wrong, that's okay. This is a learning process. Lin Bay, ask me that question again, when we finish, and then I'll answer it. Cincinnati, Ohio, I've taken it 3 times. That's cool, Ariel. I see you. You're still here and you're still fighting, right? And that's all that matters. All right, but the answer is B. The narcotic count has been incorrect in your unit for the past 3 days. General advice from the Department of Health is that stocks of controlled drugs should be kept to the minimum requirement to meet the clinical needs of the patient. They should be stored securely in a locked cabinet or safe to prevent unauthorized access with the keys held in a safe place. Once again, that is part of reduction of risk potential, right? Which is under safe and effective care environments. And that's 9 to 15%, right? Because we need to make sure legally that we have to take care of that. And also clinically, so we can't be losing these NARC counts. All right. Those are important. They are very, very much important. So shout out to everybody who got those right. All right. And if you did not get it right, circle back and understand the legal implications of making sure your narcotics counts are taken care of. Look, I think one time I had a count that was off for fentanyl, and it's because we had a code and we had RSIs and all this other stuff, and I had the fentanyl in my pocket. Next thing you know, they were doing the narc count right before I left, and they were just like, "Hey, you have a count that's off for fentanyl." I'm like, "Holy hell!" And so I reached in my pocket. Sure enough, the fentanyl was there, and they would have called me, and I would have had to go back, and if not, I would have lost my job. I would have got all up to the board of nursing. It would have been bad, right? So you got to go through that. You definitely got to go through that. All right. Make sure you have to do it safely. But anyways, question 23, the nurse is suspected of charting medication administration that he did not give. After talking to the nurse, the charge nurse should what? Call the board of nursing, file a formal reprimand, terminate the nurse, or charge the nurse with a tort. What are we thinking? Hey, if you're new here, welcome. We're doing NCLEX questions both for RNs and LPNs. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. A little bit about me. Been a nurse for 4 years, an RN. Worked ICU, OR, PACU, 16 years in this Navy, and I failed my NCLEX 3 times. So I just want to let you know that I understand every position that you guys have been in, from taking it to the first time to taking it multiple times. So I get it. All right. But the one thing we don't do here is we don't quit. All right. But the answer is B, file a formal reprimand. The next action after discussing the problem with the nurse is to document the incident by filing a formal reprimand. As a rule of thumb, nurses should avoid making assumptions when they notice gaps or missing information in a patient's treatment documentation. Healthcare professionals have exceedingly demanding schedules, but it's always better to take the time and double check the details than to make assumptions and be wrong. All right. That is safe and effective care environment. All right. That's actually part of legal aspects. Once again, part of reduction of risk potential. All right. So shout out to y'all for getting it right. If you didn't get it right, make sure you circle back. All right. So somebody keeps asking, what is tort? So nothing that Google can't show you, right? But a tort is a wrongful act to the client or his belongings and is not indicated. Right. So a tort is a civil wrong that causes harm to another person by violating a protected right. So if I put restraints on somebody, that's a tort. Right. Because I have now taken away their protected right, of them being free. Well, I'm asking you, what do you mean? Is that what you're talking about? Well, there it is. It's right there. There it is. Oh, you're asking me instead of Google? Oh, you got jokes. Okay, I got you. Oh, she got jokes. She's so funny. You're welcome. Hey, nothing that a rationale can explain to you, but this is why it's super important. If the restraints are ordered, that's a different story. If restraints are ordered, that's a different story. But situation will dictate, and that's what those protocols are for. But question 24, a home health nurse is planning for the day's visit. Which client should be seen first? So this is a management of care question. Which patient should I see first? Is it a 78 5-year-old who had a gastrectomy 3 weeks ago and has a PEG tube, a 5-month-old discharged 1 week ago with pneumonia who has been treated with amoxicillin liquid suppression, a 50-year-old with MRSA being treated with vancomycin via a PICC line, or is it a 30-year-old with an exacerbation of multiple sclerosis being treated with cortisone via a centrally placed venous catheter? What are we thinking? What are we thinking? What are we thinking? I'll give you guys 15 seconds. 15 more. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys like, share, and follow. That is the trifecta that TikTok needs. After this, I'll do a little Q&A. You guys can ask me questions about nursing, NCLEX stuff, within reason. If you start being weird, then, some of y'all can't help being weird, but y'all know what I'm talking about. But here we go. Here's our answer in 3, 2. And the answer is D, the 30-year-old with an exacerbation of multiple sclerosis being treated with cortisone via a centrally placed venous catheter. Right. So the client at highest risk for complication is the client with multiple sclerosis, right, with a central line. Okay. Multiple sclerosis is a complex disease process. In addition to sensory and visual changes, hold on a second. I swear TikTok be out here. Because now it says, hey, are you still live? Of course I'm still live. Hold on. See if that's better. All right. Where was I? In addition to sensory and visual changes, weakness, coordination problems, or spasticity can present. Other complaints related to overall health include bladder and bowel dysfunction, depression, cognitive impairment, fatigue, sexual dysfunction, sleep disturbance, and vertigo. The others are more stable. That is safe and effective control, right? Safe and effective safe and effective care environment, which is actually, this question will be part of management of care because it's asking who do you see first, all right, which is the largest section on the NCLEX at 18 to 21%. All right, TikTok is wild, I'm trying to tell you. So the key word is exacerbation. Look at you, but then also look at a central line. The patient is at highest risk as well, with the central line, highest risk for infection as well, okay? And think about it, they're getting cortisone, right? So what are they gonna be? Probably immunocompromised, right? So think about that as well. All right, question number 25. The emergency room is flooded. I'm about to say floated, but the emergency room is flooded with clients injured in a tornado. Which client should be assigned to share a room in the emergency department during a disaster? All right, so now we're talking about cohorting, like putting people together, like who can be together. Is it a schizophrenic client having visual and auditory hallucinations and a client with ulcerative colitis? Is it a client who is 6 months pregnant with abdominal pain and a patient with facial lacerations and a broken arm? Is it a child with pupils whose pupils are fixed and dilated and his parents, and a client with a frontal head injury? Or is it a client who arrives with a large puncture wound to the abdomen and the client with chest pain? What are we thinking? What are we thinking? Honestly, no clue. Give me a guess. So here's the thing on NCLEX. On NCLEX, you have to guess, even if you don't know. Apply what you know versus applying what you don't know, right? Think about it. And this is another one of those that you can circle back on, like basic care and comfort when it comes to cohorting, or having people coexist in the same room with one another, right? So think about it. If I have somebody who is immunosuppressed, I don't want to have somebody who actively has an infection in the same room with them. Okay, so think about the like-minded type of disease processes or issues that they have going on, and those are the people that need to be with one another. All right. It says B, we've done this question here before. Yep, we sure have. Here we go. Here's our answer in 3, 2, and the answer is B. A client who is 6 months pregnant with abdominal pain and a client with facial lacerations and a broken arm. The pregnant client and the client with a broken arm and facial laceration are the best choice for placing in the same room. Cohorting of patients according to the absence of specific pathogens coupled with conventional hygienic precautions can lead to a decrease in incidence and prevalence of chronic infections with these two species. Wherefore, Patient cohorting is now an integral component of infection control in patients. So, like I said, if somebody actively has MRSA, I would not put them in a room with somebody who is on neutropenic precautions. I would not do that. Or somebody who's immunosuppressed, like in Cushing's disease. If somebody's over here fighting an infection, we don't put them together. Like if somebody had a bowel resection, no, we don't put them together like that. Okay, so think about that. All right, think about that. But shout out to everybody that got that question right. And if you didn't get it right, circle back, get the knowledge. All right. Ladies and gentlemen, hey, if you're one of those individuals who's having a hard time with NCLEX, if you're that scared of NCLEX, you don't know where to start, you don't know what you don't know, right? And you need help with NCLEX, I do NCLEX coaching one-on-one. So essentially think about how we do it on TikTok, but it's not like hundreds of people that are here. So you guys can check that out. That is over there on my main page inside my link tree, or you guys can go to thebootnurse.com/coaching, fill out the questionnaire, schedule a call with me, and let's talk and see if coaching is like the right fit for you. All right. Because, hey, coaching is a relationship, and, everybody is different. We meet you where you are. All right. So just letting you guys know, hey, if you're scared, go to church, but hey, you can come to me too. All right. But make sure you guys check that out at thebootnurse.com/coaching. All right. So question number 26, the nurse is caring for a 6-year-old being admitted with a diagnosis of conjunctivitis. Before administering eye drops, the nurse should recognize that it is essential to consider which of the following. All right. So think about conjunctivitis. Think about what that looks like. Okay. So what would we do? What is important to know about someone or a child that has conjunctivitis? All right. Is that the eye should be cleansed with warm water, removing any exudate before instilling the eye drops. The child should be allowed to instill his own eye drops. The mother should be allowed to instill the eye drops. Or if the eye is clear from any redness or edema, the eye drops should be held. What are we thinking? What are we thinking? I failed my NCLEX twice. Hold on, sorry. I failed my NCLEX twice, but I had finally passed. It was a year ago now. Shout out to you. Who said that? Mrs. Tyler. Shout out to you. And you want to know why? It's because you didn't give up. Tell these people that it does not matter how many times you take this exam. And your job will never ask you. Your patients will never ask you. You'll never let that test determine what type of nurse that you're going to be. Only you can do that going forward, right? You trying to go out there and be a great nurse. Put in the work. Pass this test. This test is the last hurdle before you cross the finish line. All right. So shout out to all y'all. But here we go. Here's our answer in 3, 2. And the answer is A. The eye should be cleansed with warm water, removing any exudate, right, before instilling the eye drops. Before instilling eye drops, the nurse should cleanse the area with water. Cleanse the eyelids and lashes with cotton balls or gauze pledgets moistened with normal saline or water. This prevents debris from being carried into the eye when the conjunctival sac is exposed. All right. So that's actually part of physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. You scared to schedule mine? Hey, if you're scared to schedule it, you'll never schedule it. So how does that old saying? He was just like, what could have been will never be, I guess. So if you don't schedule it, you're never going to know. You have got to get out of your own way. You got to stop being scared of an exam, of a computer that don't got no type of emotional ties towards you. You are a smart and an intelligent individual, as Nurse Amber would say. And I truly believe that. All right. So here we go. Question number 27. The nurse is discussing meal planning with the mother of a 2-year-old toddler. Which of the following statements, if made by the mother, would require a need for further instruction? So what did the mom say that was incorrect that we need to correct her on? All right. Is it A, it is okay to give my child a white grape juice for breakfast. My child can have a grilled cheese sandwich for lunch. We are going on a camping trip this weekend. I have bought hot dogs to grill for his lunch. Or is it D, for a snack, my child can have ice cream? It says C. I got this one wrong last time. Shout out to y'all. Hey, if you guys are new here, welcome. We're doing NCLEX questions, both for RNs and LPNs. I got them off nurseslabs.com. They are free sets of questions, so you guys can go over there and check those out for yourself. But like I said, if you're new here, smash that like button, share, and follow. I need 100. Hey, give me to 100 shares and give me hey, keep smashing that like button. But I also want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? Oh, man, Bella's here, y'all. Bella is here. And the answer is C. We are going on a camping trip this weekend, and I bought hot dogs to grill for lunch. Somebody said it. It's an airway choking hazard, right? So remember the ABCs when answering this question. A hot dog in the size and shape of a child's trachea can pose a risk of aspiration. It is important to avoid foods that cause choking, like slippery foods such as whole grapes, large pieces of meat, poultry, and hot dogs, candy, and cough drops. That's health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Smaller section, but still very, very much important. From Washington, D.C., been an RN for 10 years. Shout out to you, Mrs. Tyler. So Mrs. Tyler been an RN for 10 years, y'all. She failed her NCLEX. And then guess what? I guarantee you, nobody's ever asked her how many times she's failed it. Not her job, not her colleagues, not her patients, none of them. So shout out to you. But here we go. If you got this answer wrong, make sure you circle back, get that content, okay? Here we go. Question number 28. A 2-year-old toddler. Nope, sure didn't. I knew it. A 2-year-old toddler is admitted to the hospital. Which of the following nursing interventions would you expect? All right, so let's think of what Erickson's, right? When it comes to growth and development, right? Growth and development. So what would I expect from a 2-year-old in a hospital, right? So ask the parent or guardian to leave the room when assessments are being performed. Ask the parent or guardian to take the child's favorite blanket home because anything from outside should not be brought to the hospital. Ask the parent or guardian in the room ask the parent or guardian to room in with the child, or if the child is screaming, tell him this is inappropriate behavior. What are we thinking? Says C. We say C. Okay. Everybody's telling me C. All right. Shout out to y'all. It's C. Bella, you sure? I don't know why you laughing. I don't know what's funny, Bella. Geraldine. Always with the answers, Geraldine. Says C. Okay. I'm positive. Okay. All right. I hope it's wrong now. I'm just playing. I'm just playing. Here we go. Here's our answer. 3, 2. And the answer is C. Ask the parent to room in with the child. All right. The nurse should encourage rooming in to promote parent-child attachment. It is okay for the parent to be in the room for assessment of the child. Toddlers have a strong fear of strangers, and they may feel like they are losing control and autonomy when at the hospital. Explain the procedures to them at the level of their understanding to further prevent anxiety. All right. Kids, or it says child feels comfortable with parent. Absolutely. Absolutely, right? Physiological integrity or adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right. So shout out to everybody that got that one right. If you got it wrong, hey, Erickson's. All right. Erickson's growth and development. All right. That's what you need to know. You'd be so surprised on how many of these that you would see, especially if you get a pediatric question. I feel like they ask them all the time. All right, here we go. Question number 9. Which instruction should be given to the client who is fitted for a behind the ear hearing aid? All right. So think about the behind the ear hearing aid. Okay. So what instruction should be given? So to remove the mold and clean every week, store the hearing aid in a warm place, clean the lint from the hearing aid with a toothpick, or change the batteries weekly. What are we thinking? What are we thinking? Shout out to all y'all that are here. If you guys are new, make sure you guys smash that like button, you guys share, and you guys follow. What are we? Oh, I see you said, what are you thinking? What are you thinking, Bella, since you know everything? Linbay says A. Okay. All right, well, let's see. Let us see what the answer is. Here's the answer in 3. How often do batteries even die? That's a good question, but let's see. But the answer is B. Store the hearing aid in a warm place. The hearing aid should be stored in a warm, dry place. Proper maintenance and care will extend the life of the hearing aid. Make it a habit to keep hearing aids away from heat and moisture. Avoid using hairsprays or other hair care products while wearing hearing aids. When it is exposed to moisture, it could cause serious damage. Although hearing aids are now being made to be water resistant, it's recommended they are removed when showering or swimming. If they sorry. It's kind of windy outside. I was like, what the hell is that? If they do come in contact with water, dry them immediately with a towel. Never attempt to dry them with a hairdryer or other heated devices, since the high heat can damage the hearing aids. All right, so that's health promotions and maintenance. Health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Smaller section, but still very, very much important. Well, that one took you for a turn. It does that. It does that, you know, and you'll hear so many people that'll say, you'll never see this question on NCLEX. And the national board has like over 10,000 plus type of question that they can pull from. That's number one. Number two, it's a computer adaptive exam. So you have no idea what you're going to get. So for somebody to tell you that you'll never get that question on NCLEX, who only got 85 to 150 of those questions, have no idea what they're even talking about. All right. So you never know how easy or how hard it is, but guess what? We still prepare regardless. All right. So here we go. Question number 30. A priority nursing diagnosis for a childbearing or for a child being admitted from surgery following a tonsillectomy is what? Is it body image disturbance, impaired verbal communication, risk for aspiration, or is it pain? What are we thinking? I had a test on this today. Look at you. Look at you, Bella. You smart. Kinda. Sometimes. Anyways. What are we thinking? Got everybody screaming C at me. Got everybody screaming C at me. California, is it Ryan? Rain says B. Okay. Kimmy baby says B. Don't be lame, Kev. What you mean? I've been lame since day one. Stop playing games with me. Here we go. Here's our answer in 3, 2, and the answer is C. It is the risk for aspiration. All right. Always remember ABCs when selecting. The answer choices place the child prone or sideline, right? Promoting drainage of blood and swallowing saliva from the mouth that can potentially be aspirated. Remember, tonsillectomy, right? They're getting their tonsils taken out. Remember thinking about frequent swallowing. That's showing that they're having bleeding issues, which could be an aspiration issue, right? Not like circulation, airway, breathing, all of it, everything under the sun. Sarita, thank you for the rose. I appreciate you. Did I say your name right? Sarita? Sarita. All right, we're done. But ladies and gentlemen, that is a wrap on the questions today. I appreciate y'all. Sorry I wasn't here on Monday. You know, some people, we got an adult around here. So that's what I had to do on Monday. So sorry that I was not here. But I was able to bring them to you guys today. So I appreciate everybody participating. I appreciate all the love, the likes, the gifts, all that. Although the gifts are not required, they are surely very much appreciated. So I appreciate you. Once again, I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. I don't gatekeep. This is where I got them from. So if you want to go check them out, cool. If I go too slow, also cool. You can go away. You can go look at those too. Doesn't hurt my feelings. Nonetheless, you guys are very welcome. I do the Monday, Wednesday, Friday at 5:30. Right now, the 7-day NCLEX course, ladies and gentlemen, where I have over 70 videos plus 2 NCLEX reviews and a community where I go live as well. You can join that right now for $7. You can join it for $7. All right. And you guys can go over there and check that out. Check that free download that I have. Go pre-order my book, Conquer It, so you guys can understand why you should never be scared of this NCLEX. All right. And I also do one-on-one coaching for NCLEX. So if you don't know where to start, don't know where to begin, you're unsure of yourself, you don't understand how to break down questions, you don't understand content, and you want one-on-one attention to where I can help you really pull all that together, you can check that out at thebootnurse.com/coaching. All right. Do you have NGN on there? So on my reviews, I have NGN questions on there. And by NGN, all it is just, hold on, turn this camera around. All the NGN questions really are. What's up, y'all? Hey, I'm looking kind of like crazy. I don't know what happened here. Look, it's just wild out here. So it all really just depends. But for the NGN, the only thing that's being delivered differently is the fact that they're case studies. That's it. So, but the content is still the same. But with the NGN, they give you case studies. But with the questions, they're extended multiple choice. What else? Extended multiple choice, matrix, select all that apply. So I go through those type of questions as well. Give me a little snippet of the book. So a snippet of the book is essentially telling you to get off the beach. And if you've been here, you already know what the story is. Essentially, get off the beach. A World War II reference. Right, during the invasion of Normandy to go stop Hitler from doing Hitler things, right? As they were invading those beaches and they were storming them, they were getting mowed down. So I like to use the analogy, two people that stay on the beach, the dead and those that are going to die. And so I use that as a way for you not to progress in life. You can either stay on the beach or you can fight through all the gunfire, aka the world that is pushing you and holding you back, or your own fears, your own anxieties. You can push through those. So the goal is to get off your beach. That's what the snippet, that's a snippet of it. And that's like just an overall synopsis of it, but it's going to be good. It's going to be good. Lynn Bay says you have a question. What's the question? Thank you. Good for a refreshment. Hey, Miss Tyler, I'm glad that was helpful for you. Thank you, sir. If you do a meet and greet when you come to Boca, I'll be there. Yes, ma'am. We'll talk about that. Good metaphor. Okay, Kev, free gang. Look, I'm trying to tell you. It says, I was going to ask, should I only study NGN if that's what if that. So the thing about it, and this is where the confusion is at, is that all the new generation NCLEX is just for the fact that they've added case studies. That's it. There's nothing different. They just added case studies. So you get as much information as you could possibly get, but you still have to be able to interpret EKGs. You still have to understand the critical thinking. You still got to be able to answer your questions. Now they have select all that applies to where they're like partial credit, or plus and minus, so like the biggest thing that you need to incorporate, you still need to have your multiple choice in there. You still need to have your select all that apply, but you need to understand what the case study format looks like. Good metaphor. Yep, for sure. Is it possible to do case studies in live? You're talking about like case studies here. So I've done case studies on here before, but for some reason people didn't want them. So, but we'll see. We'll see about doing them some more. Kev, I graduate May 8th. Oh yeah, you do graduate May 8th. Look, you got it. You already know what the deal is. On a personal level, which of the areas that you've worked do you prefer and why, if you don't mind? I personally, every single one of them have their own perks and pros and cons. I love the ICU because you learn so much about critical care, and that's like the in my opinion, that's like peak of like knowing what's going on with a patient. But when I was going through when I was in the ICU, it was during the second wave of COVID, and there was just too many unethical things that I wasn't cool with. I like PACU because you have one patient, or you'll have two patients at a time, nothing more than that usually. And they usually are like coming from the OR or from a procedure. Biggest thing that we're worried about is airway, and then them coming down off of the anesthesia and then transporting them. So you'd have them for like an hour. But of course, I like the OR because it's one patient at a time. It's you, a surge tech, the surgeon, and anesthesia. You're at least going to have 4 people. So they all have their own pros and cons. I personally like the PACU out of all 3. Another question, as a nurse, is it possible to always have a set schedule of 3 days? No, it's not. Oh, it is set. It is possible for you to do that. Yes. At the beginning, probably not, because they're gonna put you where they need you. So you got a job offer at the ICU. That's what I'm talking about, Bella. Go out there and do great stuff. Hey, you already know what you got to do, though. You already know what you got to do. But I love that for you. I love that for you. Complete different conversation than what we had back in December. So PACU is the post-anesthesia care unit. So post-anesthesia care unit, or the recovery room, where people are coming down off of general anesthesia. So, we're watching them because obviously they're on a lot of medications to paralyze them, and they're on the vent being controlled, all the breathing and stuff getting controlled. So all that good stuff. Yeah, I know what the deal is. What does step down mean? So step down essentially is it's a lower tier under the intensive care unit, if that makes sense. So the intensive care unit, they have everything under the sun going on. And as they get upgraded, and by upgraded, that means they're getting downgraded, they're getting downgraded to step down, which means that they're getting better. So you're that next tier of healthcare or care that's being given that's showing that they're having some type of improvement. Nat says, I love this page. I learned a lot. Nat, I'm glad that you love it. Make sure you like, make sure you share, make sure you follow, have that notification on, okay? To be in, or what's needed, just base RN. What do you mean? What do you mean, Lin Bay? You got to give me a little bit more context. 10-year Medicare in nursing school farm is whooping me. I bet. Did anybody see my video that I posted? Is pharmacology hard for NCLEX? Yes, it is hard. I don't care what nobody tells you. It's hard. You'll find more people that'll say pharmacology is hard than saying that it was easy. Thank you for your insight. I'm hoping to get into the ICU when I graduate. Look, Abdullah, put it in. Apply for an ICU job or apply for ICU residency, whatever you decide that you want to do for yourself. Make sure you read the fine print and do it. You can go straight into the ICU right out of school. There's nowhere where it says, there's nothing doctrine that says that you have to go med surg or anything else. All right. Some places will want you to have more experience than others, but if ICU is where you want to go, then go. I've never worked a med surg. I mean, not saying I never worked a med surg floor, but I've never been hired to work a med surg floor. I did critical care, then I did PACU, then I did OR. And the only reason I went back to the OR is because I was a surgical tech, so I understand that realm. All right. It says, do you need, hold on, Linbay, because your whole question didn't come through. It says, or do you need a year's experience, or can you go straight in as a new grad? So Linbay, are you asking, can you go straight into the OR or other services without having experience? The answer is yes. Oh, you want to go into the operating room. Okay. So you're asking if you can go into the operating room without any experience. And the answer is yes. You can get into an OR residency program, or what they call a perioperative residency program, and you can go straight and work into the operating room. You sure can. It says, I've worked med surg. I currently am. Well, no one's saying anything about you not. Nobody's saying anything about med surg, Bella. I'm just saying that you don't have to go to med surg. Most LPNs or LVNs, majority of the time, if they're not going to a long-term care facility, that's exactly where they're going, is they're going to med surg. If you want it, go for it. Love the experience. There it is. Is that Genilde? Did I say that right? Genilde? Very, very correct. If that's what you want, go for it. Nicola says, steps to do NCLEX exam if you're from another country. So Nicola, you have to apply to if you're going to Canada, you got to apply at the national level. It's a credentialing board if you're coming from a different country. And same thing with the United States. If you're coming to the United States, if you were already a nurse in another country, and you're coming to the United States or Canada and you want to work here, you have to send all of your stuff to a credentialing board. They have to go through it and make sure that you check out. And then they're going to tell you, okay, you can take the exam here in the United States. And if you pass it, then you can work here. If not, then can't work here. Lynn Bay says, I feel like I'm leaning more towards elderly care, to be honest. I'm sorry, y'all. This phone is kind of late, but it says, I feel like I'm leaning more towards elderly care. What's your opinion on that? Bro, if that's where you want to go, go. If elderly people is where your heart is at, bro, go. Trust me, elderly people are awesome. There's wisdom there. You know what I'm saying? So if you want to do community care, or if you want to do a long-term care facility or whatever, please, by all means, go to where you want. No, I was just elaborating. I got a lot of experience. Oh, for sure. 100%. You definitely, I would never say not go to med-surg and not get experience, because med-surg is a specialty. People need to realize that. Med-surg 100% is a specialty. So go there if that's where you want to go. Or even if you don't know where to go to med-surg. Lele says, since it's been a month, would I need more than 30 days of one-on-one boot camp before I schedule my test? Lele, so I've coached people for 7 days, 14 days, 21 days, 30 days, everything in between 7 days and 90 days. So based off of a call that we would have, it would really depend on you. I've coached people for 30 days and they passed. I've coached people for 45 days and they passed. So honestly, it really just depends on you and how much you're picking up, what's being put down. Abdullah says, I was a tech in med-surg. Woo, the ghetto. You learn a lot from facts, right? Brian says, not able to learn. What do you mean not able to learn? You love hospice? Hey, if hospice is where you want to go, there needs to be nurses that are there. There needs to be nurses that are there to facilitate, end of life. And that's a specialty in itself as well. It says, Gura to where, go to where your heart is at. It does take passion to be a nurse. And here's something else I'm going to tell you. If you start to feel emotionally disconnected and you lose your passion for whatever area that you are in, please, 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 please leave that area. Go some, if you're getting burnt out, or if you're like not liking life, or you're not liking whatever, it's okay for you to change. It's okay for a change. Trust and believe me. Hey, if you guys are new here, welcome. We do NCLEX questions every Monday, Wednesday, Friday at 5:30. If you missed them, you missed them. And obviously it's past that time. So make sure you guys like, share, and follow. Understand, and turn on that notification bell so you guys know when I'm going live, so you guys can get this knowledge. All right. But what other questions do you guys have about nursing, NCLEX in general? All right. What other questions do you guys have? It says, man, I graduated nursing school in 2021 in Puerto Rico and came to the States. Been a battle since, to be honest. I believe it. I've actually coached 2 girls that lived in Puerto Rico that were nurses, and they were battling the NCLEX, and I coached them, and they both passed. So, but it's doable. It's very, very doable. Hey, listen, I graduated nursing school in 2018, and I didn't get my license until 2020. No one's ever going to know. No one's ever going to know what your struggle is. The only thing that they're going to see is the fact that you passed. But they don't understand. No one understands what it's like to be in your shoes, going through those step-by-step processes in order for you to get there. All right, well, when I come to you for a one-on-one, be ready. Hey, look, trust me, you can come to me for one-on-ones as much as you want. You wouldn't be the first person that I've coached that has not passed the exam, right? Remember, I coached somebody who passed on their 12th attempt. You know what I'm saying? Somebody who's passed on their 4th, 7th attempt. The biggest thing is, are you coachable? And if you're not coachable, then I'm not the dude for you. And I've told people that before. I was like, coaching is just not right for you, at least not with me. So, hey, but the real thing is you be ready. But what else? What else do you guys got? It says in Florida, it's only 3 till I got to take a remedial course. So that's very true. So everybody that is in a state, listen to me. I need all y'all to listen. I need for all of y'all to lock in right now. Is if you are one of those states like Florida or California or wherever, you can actually apply in different states to get a license through them. For example, you're in Florida, Lynn Bay, right? You can actually apply to get a nursing license through the state of New York. Or you can apply to get a nursing license through the state of Ohio, because they have unlimited attempts. So multiple state, yes. However, in a sense of working, yes, it's a multi-state, right? So once you get the license and it's a compact state, yes, you can do that. Jersey does that too, I think so as well. So, but you got to realize is that New York, I don't think is a part of the nursing licensure compact. I got to double check, but at that point, it doesn't matter, because now you already have a license. It won't matter, because now all you got to do is now go apply for a license at a different state. Philadelphia is a compact. So Philadelphia is a city. Pennsylvania is a state. So if Pennsylvania does that, then cool. Philadelphia is not a state regulator, if that makes sense. No, you're good. I got you. It says, I wish I would have known that. I already damn near finished and about to schedule the test. All right, cool. Hey, but think about it. Even if you fail a third time, you can still transfer that. Or if you're already ready to schedule your test, and you want somebody to help you, you know where to find me. So yes, Ohio is also unlimited as well. I think Missouri is as well. I don't know. I feel like that remedial. You feel like that. You feel like that remedial as well. Remedial course might be what I need if I fail the third time. Look. So here's the thing about the remedial course that you don't know, is that the state of Florida is going to make you go to it. Right? You're going to have to go to it, right? And they have selective ones that you have to go to. Selective ones that you have to pick from. And it's like $2,000 for you to go to that remedial course. That's number 1, or number 2, right? Because there's a category that they only give you of the ones that you can go to, and it's $2,000, right? And I want to say it's like a month or 2 months. Maybe somebody else can elaborate on that. But then if you don't do well in that remedial course, the remedial course will send a red light or a green light to the Board of Nursing. And the Board of Nursing will be like, oh, the remedial course said that you aren't good to go, so you can't take your exam. You see what I'm saying? Like, they're telling you that you cannot take your exam. 6 to 8 weeks. So think about it, a month and a half to 2 months. If the remedial course tells them that you are not doing well in that course, you're not taking that exam. Versus if you got coaching with me, I'm going to tell you, hey, you're not ready for that exam. You need to study a little bit more, and we're going to fix that. And then I'm going to be like, hey, I think you're good to go. Versus, some program that's supposed to work, not saying it doesn't, because obviously it's there for a reason. They hold your fate. So just think about that. And if you want to fact check me, hey, go to the Florida Board of Nursing and look. What's a remedial? Isn't it clinicals? No. So the remedial is essentially going through nursing content and going through questions and answers. That's all it is. Going through nursing content. It's kind of like doing another. It's like doing a 2-month or like a 2-month NCLEX crash course. That's what it is. It says, all right, well, I'll definitely be messaging you, man. Thanks for all the info. Looking forward to the coach. There it is. I appreciate you. By the way, like I said, if you want to fact check me, I don't got no problem with that. Go to Florida Board of Nursing, look up their specific ones and start and do the research. Look on YouTube and see people that had to do it and watch them say the same thing. Pass or fail. Pass or fail what, Janelle? What are we talking about? Hey, if you guys are just now joining, we're doing NCLEX questions, or we did NCLEX questions. I'm going to hang out for a couple more minutes answering some questions. I missed out on Monday because, I had to adult. And I got like messages from about 4 or 5 people asking me if I was okay and how everything was going. And I'm just like, y'all miss me or what? But I appreciate everybody that reaches out. So, but they realize that nursing is in a very, it's in a very fragile state right now. It's in a very fragile state. So everybody has to realize what you're truly getting yourself into. You still a RN working. So I work from home now. Missed a review again. Elizabeth. Liz. Yes, you did. You did miss it. You did miss it. That's okay though. You know where I'm at. And and if you miss any of my lives, you can go check them out. They're on YouTube. And the link for my YouTube is in my main page. So you can go check that out as well. But Liz, see what happens? You got to follow. Turn that notification button on when I'm here. You know what I'm saying? But Lin Bay, I work from home now. And I strictly do coaching, NCLEX coaching and my NCLEX course full time. So, and I do that for y'all. So what other questions do you guys have? Who is that? CJ, thank you for joining. I see you. It says be back Friday. I do follow. Just missed the notification. Dang it. That's okay though. That's okay, Elizabeth, Marty, thank you for joining. It says, well, I'm going to go. Hope you're doing well. Yep, absolutely. Abdullah, hope to see you on the next one. All right. Hey, but what other questions do you guys have? So, hey, if you have any questions about getting into nursing school, how to get through nursing school, how to graduate, how to take the NCLEX, which is what I feel like I'm a professional on now. Your first nursing job, imposter syndrome within your first year of nursing school, what to do after nursing school. That's a big one, like what do you want to do after nursing school? What do you want to do after your first year? I'm telling you right now, once you get 6 months to a year of experience working as a floor nurse, you have experience to leave floor nursing to go to other things. Like you can go work at a clinic. A lot of women want to go be an esthetician and go do stuff like that. Yeah, most definitely. Can an LPN just be specialized in wound care? Yeah, they have wound care. They have, you can get certified as a wound care specialist, right? And then you can find those jobs to where you just do wound care, for sure. How do I get through nursing school without being stressed out? Good luck. Good luck. Because even with a really strict schedule, you're going to be stressed out. So the best way to alleviate the stress, a time management schedule, making sure you know everything that's going on. And honestly, and I kid you not, is taking breaks. So when spring break comes around, but you still know that you got to do some stuff, take some time for yourself, spend some time with your family, like unplug just a little bit. Okay. You have to be able to put the book down sometimes in order for you to recalibrate. Okay. Imposter after LPN to RN. What do you mean, Elizabeth? What do you mean? Like you have imposter syndrome from being an LPN to going to an RN? Dealing with imposter syndrome when advancing from LPN to RN. Okay. So as you as you advance from being an LPN, you realize it's like you have you have more levels of a responsibility. And with the imposter syndrome, that'll eventually go away, because just like everything, it becomes a routine and you get used to it, right? But then everything is a learning process. So the way that I deal with imposter syndrome is I was very verbal about that. I was like, listen, I don't feel like, for some reason, I'm not picking this up. And is there an easier way, or am I doing something wrong? Let me know, expressing myself that way, taking down notes and always asking questions. But imposter syndrome is going to be, it's going to be a thing. Like, you understand how to physically do the tasks that an LPN can do. But it's the other aspects of the whys that you learn as an RN that you may not know or have been taught as an LPN, if that makes sense. So the biggest part about imposter syndrome as well is time. It's timing. Everybody goes through it, and they're lying to you if they say that they didn't, because every nurse goes through imposter syndrome. Everyone. So that was a good question. And Nat, that was a good question as well. But you guys are kind of short on the questions now. I guess I should be that one dude who's out in California, that Asian dude. I guess I should be him, because that dude gets like 500 people in here just sitting here watching. I forgot what his name was. I don't follow him, but he's like, the algorithm pretty much brought him to me. So if y'all know what I'm talking about. But yeah. But what other questions do you guys have? If you guys don't have any other questions, look, I'm about to go get my eat on. Is it John? That's his name, right? He lives out in California. And he talks about, like, he's real sarcastic, I think is his name. He's real sarcastic. I'm just like, wait, are you serious? And then I see people in there asking him questions. He ignores them, like damn near half of them. And then I think he roasts a lot of people in there. He was like, dude, if you're trying to be a nurse, you want to be rich, you're in the wrong fucking. I was like, wow, that's hilarious and true. So shout out to John. So, well, what else? What other questions you guys have? Hey, if you guys are just now joining, we went through NCLEX questions. We do NCLEX questions Monday, Wednesday, Friday at 5:30, both for RNs and LPNs. All right. And if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if there's any questions that you have about nursing or NCLEX, or, what to do after nursing school, how to get into nursing school, how to survive nursing school. I'm a very, very big proponent of being part of study groups. And by study groups, I mean a small group. And I mean you and 3 other people, because that right there is that's the way that I got through nursing school. Like, I couldn't do it by myself. I'll be completely honest with you, because nursing is not an individual thing. It's a team sport, whether you want to believe it or not. Because there's going to be somebody in that group who is going to have a little bit more knowledge than you. That's definitely going to be like, hey, look at this. And you're like, oh man, I never thought about that. So Elizabeth says Florida nurses don't make good money for sure, especially for the cost of living. In fact, same thing in Texas. You would think that nurses would make good money as staff nurses here in Texas, but they don't, because the cost of living is low here, and they lowball nurses terribly. Terribly. That's why you guys got to understand and learn how to negotiate as well. You guys got to learn how to negotiate. That's what I'm trying to tell you. Get you a year of experience somewhere, and then go to another facility where they're going to pay you fucking $10, $15 more than what you're getting paid. All right. Have to do it for the love of it. You do have to do it for the love of it, but doing it for the love of it is not going to take care of you. I mean, you went to school for a long period of time for a specific reason, and you should be compensated properly for that. Sorry. And you're here. I'm trying to tell y'all, you guys gotta develop thick skin. They're gonna be like, you're letting the team down. Hey, bro, I need for you to pay me, because I have a mortgage, I have a car, I have kids. Like, we got stuff we got to do around here. What do you mean you're letting the team down? You know how many messages I've gotten when they were just like, hey, Kev, we're shorthanded, we would really need you. I was like, damn, that sucks. That's it. That's all I got. And then it got to the point where they just stopped asking me. And then I ended up getting a text message from a few people that I work with. They were just like, bro, can you please come in and help? And they were just like, we're slammed. And I was like, all right, since you asked, here I come. Right? And then, of course, it was a shit show. And then I was like, I'm never doing that again. But you guys got to be able to have thick skin. I'm telling you right now, my favorite word is no. Telling it to my kids, telling it to everybody. I'm telling you right now, you better learn how to say no. You better learn how to say no. You better learn how to open up your mouth and defend yourself, because I'm telling you right now, you will get ran over. They will run over you. They will run over you. And that's the last thing that you want because you're going to get burnt out. It says saying instead of taking a remedial course, you could just apply for your license in a different state. Yeah, I did say that. I indeed said that. It's not illegal. It's not wrong. I've had somebody flat out come in here to tell me that I am an enabler for allowing people or for coaching people who have failed the NCLEX. And I was just like, I'm sorry. I'm like, what do you mean? Like, explain your logic to me, sir or ma'am, or whatever you identify as. I was just like, I don't go to people. They come to me. They ask for help, so I help them. I didn't do anything wrong. What do you mean? It says, Sammy Nurse says, remember, no is a complete sentence. You damn right it is. Ooh, I like that. I like that. Oh, Sassy Nurse, not Sammy Nurse, but Sassy Nurse. But I like that. No is a complete sentence. And no can be said in many different ways. And guess what? Did you know that no is pretty universal across the world? Everyone knows what it means. Doesn't matter what the language is. If I say no, they're going to be like, Michelle, you are welcome. But Lele, yeah, somebody told me that I was an enabler for helping people pass the NCLEX that failed because by them failing the NCLEX, that shows that they're unsafe nurses. And I was just like, no. What shows that they're an unsafe nurse is them performing nursing tasks unsafely. Am I wrong? Am I wrong? This test is a baseline to make sure that you understand basic nursing safety. You learn how to you become a nurse and you learn all the ins and outs of a nurse as you work as a nurse. So Michelle says, you just saved me $2K. I did just save you $2K. You're welcome. You're very welcome. However, if I just saved you $2K, go buy my NCLEX course. You can start it for $7. Okay, so stop playing. Understand the basics. That's exactly what it is. That's exactly what it is, right? And that's what. Oh, and Michelle, like seriously, like one of the girls. Okay, who was it? I think it was not Candace. It was Crystal. She lives in Florida, and she failed twice, I think, or she failed. Yeah, she failed the NCLEX 3 times. In Florida, and she transferred her stuff to Georgia. Passed, and when she started coaching with me, passed on the next try. So I'm just saying, the biggest thing about saving the $2,000 is for the fact that this entity sends the board of nursing the green light or the red light for you to test or not. That's the thing. Versus with my coaching, I'm just going to be like, hey, nah. We need to, we got to restructure something. You see what I'm saying? So I'm just letting you know. It says I did. It was a very good set. It was a very good your 7-day. Okay, I appreciate that. I really do appreciate that. And I actually just got finished recording like 10 videos for my cardiology section and some other videos that are going to be going in the NCLEX mindset that everybody needs to be aware of. So those are going to be going up here in the next like week or two. So got to get those edited and got to get them right. So what other questions do you guys have? What other questions do you guys have? I like that. No is a complete sentence. I love that. Don't you be asking me to come in to do nothing, because best believe ain't nobody come in to help. It says, does it increase after 7 days? It does. It's a 7-day trial for $7. And then after that, it goes to a monthly subscription of $97. I cannot get on your Nurse Boot site. Nat, so here, I'll just do this. I'll do this, so I'll turn it around. Hold on. So the website's right here. All you need to do is just go to that website right there. And it'll take you there. I don't know why. I don't know if it's because I'm on live that it doesn't work or whatever, but essentially this is where it'll take you. I click on there. It'll take you here. A systematic approach. All right, that sounds terrible because I hate my voice sometimes. So right here, you can join for $7. We talk about everything. This is everything that it comes with. We talk about the NCLEX mindset, the NCLEX structure, critical thinking. Who was it? Michelle. Hey, correct me if I'm wrong, but you see critical thinking and pharmacology and management of care, physiology. You see those things inside the course, right? And then under here, we talk about the course curriculum. These are the things that you get, right? All the videos that are in there, right? And then you get a review over the 7 days, right? And then you get content, right? You get tons of that. So yeah, Michelle's like, yes, that's all in there, right? And then of course you get to be a part of a community, right? You get to be a part of that. And then of course that's me looking all dapper when I was at the burn center, working in the burn ICU. And it talks about who this course is for, who it's not for. And of course, this young lady, this is Joy. She passed her NCLEX using my review as well. And then here's some other testimonies that is there. And then of course, right here, like I said, you can join the 7-day NCLEX course for $7. $7 gets you 7 days, and then after that, it's a 30-day subscription. You get an on-demand 7-day course or 7-day review. You get a next generation review. Yeah, there's over 100 hours of content videos that are in there, access to an exclusive community, and then we add stuff every month. And then, of course, this is both for RNs and LPNs, all right? And then you can go over there and you can check that out. Frequently asked questions are down here at the bottom, so on and so forth. And like I said, after the 7 days, it goes to a subscription. And after the subscription, after the subscription, it goes, after the 7 days, it goes to a subscription base. So hopefully that was to give you guys some clarity, but it is thebootnurse.com /special. All right. So I'm gonna hang out here for about another 5 minutes. But what other questions do you guys have? If you guys are new and just now joining, make sure you guys like, share, and follow, because I do NCLEX questions every Monday, Wednesday, and Friday at 5:30. I actually had somebody reach out to me and they want me to come do a live NCLEX review for their cohort. So, live in-person NCLEX reviews, maybe in the future. Maybe in the future for some, right? Also, I'm working on a virtual live NCLEX review, where it'll be over a couple of days, rather it be than 3 days, so on and so forth. So I know. 7 days. I like 7 days is because I like things to be digestible. Everybody's in such a rush. You're all in such a rush. Why? Where are you going? Digest. Let all that marinate and let it just digest into your brain so you understand it. I'm just saying. All right. What other questions do you guys have? Is that Jiminy? Thanks for joining. Appreciate you. What other questions you guys got? I'm pretty sure Grace is in here freaking lurking, as she always does. All she does is just listen, and she participates, kinda. And then when I say it's time for me to leave, she's like, there you go, Kevin, thank you. So. Sorry, there's my son. Nurse K, just passed my term, now heading to my final in nurse. That's what I'm talking about, Nurse K. That's what I'm talking about. Shout out to me. No, girl, shout out to you. But I appreciate that. Thank you. Hey, whatever is helping, I'm glad that that's being helpful for you. Is your boot camp $7 per day? No, it's $7 for 7 days. And then after 7 days, it goes to a monthly subscription. I'm preparing for TEAS exam and I don't know. I feel lost. Some advice. So is it Saray? So Saray, here's one thing. There's a book. It's by Mometrix. It's Moetrix. You can Google it or you can look on Amazon. It's Mometrix. It's a yellow book, a yellow Mometrix book for TEAS, and that is very super duper helpful. I never took the TEAS. However, I use that for HESI. It was one of them, right? And then another one that is I would recommend that you follow. Her name is the Nurse Sam. So it's the Nurse Sam, SAM, and she does TEAS and HESI like reviews every Tuesday on her TikTok live. TEAS and HESI are not my forte. The NCLEX is my forte. But Sam will get you right over there because she does those lives over there. So I would recommend checking her out for sure. Sam is actually one of, there's a small knit group of people that do NCLEX reviews and stuff like that. And Sam is one of those ones that I've been following for a while. And her and I are cool. And I would recommend going to go check her out. She has some really good stuff for TEAS and for HESI, for the entrance exams. So what other questions you guys have? I got about like 2 minutes before I jump off here. You're welcome, Saray. No problem. If you guys are just now joining, we do NCLEX questions at the start of this live at 5:30, Monday, Wednesday, and Friday. So make sure you guys like, share, and you guys follow. That's the trifecta that TikTok needs in order for me to get into the For You page, because that's how most of y'all found me, right? So make sure you guys go over there and check that out. Check out my links in my bio, right? If you, hey, I got a free download that's over there. If you guys haven't picked that up, 42 pages of test taking tips to help you conquer the NCLEX. I also have an ebook over there, over 700 pages, to help get you right. If you're a reader and you want to have it on an ebook, or you want it on a document and you can print it out and do all that stuff, it's there for you as well. It's a non-nursing question, but do you have any info on how to open a group home or assisted living? Lele, I do not. However, there is a Facebook group. I think it's called Nurses in Real Estate. You could join that on Facebook. I think it's called Nurses in Real Estate. Check that out, because they talk about, like, I think they talk about nursing homes and assisted living as well. And technically, I mean, I guess that is a nursing question, because it's a group home and assisted living, right? But you could also be the real estate owner of that building. You know, if you're one of those people who's trying to better, you know, the nursing home, long-term care facility, assisted living experience for our older population, right? Because some places are not good. Some places are not good. And I would never send my mother to any of them. I would not. Because man, oh man, oh man, especially with my knowledge of being a nurse, I would tear that place apart. I would tear it apart. So, but anyways, what other questions you guys have? I'm going to get off here. And if you guys don't have any other questions, I will bounce. I'll bounce when I walk. And by that, I mean with the cakes, because I got some. Anyways, all right, y'all. Well, I'm going to go ahead. I'm going to call it a night. It's already 7:30. Hey, make sure you guys are following Nurse Amber or Nurse Glambert. I know that she's going to be going live here in the next half hour. So make sure you guys go follow her. You know what I'm saying? She's good people's. She's good people's. Her and I are going to do something together here come soon. Also, Nurse Larissa. Make sure you guys go over and check her out as well. Make sure you guys go to my link in my bio and check out everything that I have going on. The free download, the ebook, my book, Conquer It. You can pre-order it right now. Check out the 7-day NCLEX course. You can join the 7-day NCLEX course for $7. And if you're one of those people who needs further guidance, don't know where to start, don't know where to begin, as well as need help breaking down NCLEX style questions, you want accountability, you want us to create a schedule, do you want me to track your progress so I can show you and tell you, hey, this is what you're messing up on. Let's talk about it. Let's get you right. You know, you want my phone number so you can talk to me all the time. Not all the time, but you know what I mean? And you want to do live sessions with me, one-on-one, check out the NCLEX coaching and mentoring. That link is in my bio, in my link tree. You can't miss it. Fill out the questionnaire and schedule a call with me, and let's see what we can do for you. All right. Trust me, there's nothing that you're going to be able to tell me that I have never done or experienced before with my almost 10 years of teaching background, as well as my multiple NCLEX failures. All right. So anyways, I appreciate everybody being here on this Wednesday and for participating. Make sure you guys take care of yourself, because if you can't take care of yourself, you can't take care of nobody else. Remember, a dream without goals is just a wish. Remember, Denzel says he was just like, you need discipline. Without discipline, you'll never start. But more importantly, without consistency, you will never finish. All right. So you were disciplined to start nursing school. You were disciplined to go through the whole process, but you have to stay consistent in order for you to get to accomplish that goal that you're looking to accomplish. All right. So with that being said, I appreciate everybody being here, rocking out with me. And until then, ladies and gentlemen, I will see everybody on Friday. Have a good, safe